Hi folks, it's Dr. Small from Armstrong Small Eye Care Center, and I just wanted to let everybody know that, as most of you probably know, we've been allowed to return to work following all this pandemic stuff going on. So I just wanted to do a little walkthrough. I apologize for probably the length of this, and I'm also going to be looking at notes to kind of review our commitment to health and safety for our patients and for our staff, for our doctors, for everyone, just so that we can continue to make this work and follow proper protocols. We've been looking at these protocols for quite a while, and now suddenly when we could potentially be back to work on Monday, today's Wednesday the 29th, we could be back to work on May the 4th. We had a lot of work to do, and you'll see that the clinic is in sort of reorganization phase, but I just want to walk you through what you can kind of expect when you come in. And number one is this front door is going to be locked. We really have to control how many people we have in here. We think we can probably have anywhere from 4 to 5 patients maximum in our little office that gets pretty tight pretty quick when you're trying to keep 6 feet away. So when you first come in, one of the first things we're going to be asking you to do is one, hopefully when we talk to you and reschedule your appointments with our new schedule, that you bring your own mask. If you have a mask, if you have access to masks, we, this PPE that I didn't even know that term a month ago, now it's become super prominent in the news, prominent everywhere, prominent for us. So that's personal protective equipment. So if you've got your own mask, we ask that you bring it, ask that you wear it, and you're going to be wearing it the whole time that you're in our building. You're going to want to grab at it, you're going to want to touch it, you're going to want to move it when you talk, all those kind of things. Try your best to either keep your hands clasped or have them in your pockets, because you really don't want to touch it as best you can. You're going to be protecting us, and hence we will be wearing masks the entire time. And that goes for all the staff. You'll also see that some of our staff will be in face shields, especially when they have to get a little bit closer to you. Some of our technicians will be wearing that. So once you have your appointment, you arrive at the door, you'll be calling our staff, who will then what we're going to call our sanitization engineers, going to show up and help you. If you need a mask, there it is, and also to hand sanitize those hands and actually get you to wipe them down a little longer than you normally would. Then we're going to be escorting you back into the office here, and at our huge desk, which is always so big, we still laugh at how big that is. But anyway, we're going to have partitions on there protecting the staff who are sitting at the reception area. You'll see also that our waiting room, we're down to about, it's hard to get everything in here, but we're down to about three chairs, and we don't anticipate having a lot of people in the waiting room. We're actually getting brand new chairs that are much easier to clean than the ones that we have currently that are cloth. We need to be able to clean those quickly, and as soon as somebody's touched that, we need to have that. Most of the staff will also have on gloves, or they've been hand sanitizing or washing their hands with soap and water. So once we get you checked in, then you'll be heading to Pretest. Just looking at my notes to see, the other thing is that when you do arrive, you may be asked to wait in your car. That's another sort of part of the thing. It's luckily not too hot or not too cold out right now. So once we tell you, and we either will come out to get you or we'll call you. We realize that some people aren't going to have cell phones, so it's a bit of an issue right off the hop. We'll try and work around that. You're going to ask for a lot of patience from us. We'll ask for a lot of patience from you, so we appreciate that. We also, when you come in, you're going to be alone. We don't want you here with whoever that you might be normally coming in with. We really want you by yourself. We want as minimal people in here as we can. Obviously, if you've got a minor or someone that requires some assistance, we understand that. But once they're inside, we may ask that the person that's accompanying you to leave. Obviously, if it's mom or dad or something like that. But the days of having entire families in here together is unfortunately over for now. Hopefully, we can get back to that. I showed you the waiting room, but you're going to work your way over to the Pretest. In the Pretest area, we'll continue to do much of the same thing. One of the things that most of our patients are going to be pretty excited about, although that's a fairly dark room right now, is that puff of air. We're not going to do that. That's an aerosol spray. We'll be doing a different way to measure the pressure inside your eye. So a lot of people don't like that puff, so it's not such a bad thing. And we've got a newer tool called the Eye Care, and that procedure is called tonometry. We'll be using the Eye Care tonometer. We'll still be taking pictures of the back of your eye. We'll still be doing another, what we call the auto refraction, which will give us an approximation of your prescription. And then once that's done, well, our sanitization engineer is going to be going into that room and wiping the entire thing down once you leave. You'll be headed then into one of our exam rooms that has already been sanitized, that has been completely cleaned by the doc and by the sanitization engineer. I can barely say that. And the doctor will probably be sitting a little bit further away. I've got a lot of junk in these exam rooms right now, but be sitting a little bit further away from you than normal, and just something to be aware of. We're also talking a little bit about maybe taking more case histories before you even come in for your exam, so that we've got most of that information, and trying to keep talking to a minimum. You can imagine asking me to talk a little bit less is nearly impossible, but we're trying to keep everybody safe and trying to just do what we're supposed to do, and that is the exam itself. The other thing that'll come up is that if it's just routine exam that you're having, maybe we look at extending you out a little bit further, maybe a little month or two further out than normally you would, or maybe 2 to 3 months. So again, those who are having definite problems that have been waiting through this for the last month and a half, 2 months, we're going to probably put them up at the top of the list. I mentioned the partitions at the front. I mentioned all the disinfected instruments, minimal discussions, routine. The other thing at the front that I didn't mention is that all our magazines, toys, all the stuff that normally is out for people to do while they're waiting, none of that's going to be around. We want, again, you touching minimal as possible. All our drops that are normally on right here have been moved, and they're in glass shelves back behind the reception area. So those are still available for sale, still available for retail, but we'll be grabbing those for you. Again, trying to minimize how much we touch. The other thing is that for those, we monitor quite a bit of glaucoma here, which usually includes a visual field. For those who aren't familiar, the visual field, sorry as I get close to the camera here, has a large inner bowl to it. And because you'd be sitting there for quite a while, that test is often 5 minutes an eye. We won't be running any visual fields. There are other ways to monitor glaucoma, so don't worry don't fret if you do have glaucoma, and there's other ways to do visual fields. But at this point, we'll be doing it a little bit differently. So that's something else to add in there. Also, for those of you who are looking to get fit into contact lenses, our protocols state that we should not be doing any new contact lens trainings, because that can also take some time. Some people figure it out in 5 minutes of training. Some others come twice at 3 hours a pop. So we just can't have us as close to you for that reason during that time. Also, so we're going to have a lot of people that are coming in for repairs, and also to pick up their glasses that have been sitting here, the ones that we haven't been able to mail out. Well, the only way that we're going to be able to do that and control how many people come in is that we're going to have actual appointments for those services as well. So lots of changes, lots of stuff going on. We've still, as I walk back out here now, you can see in our dispensary over here, we've got no frames up. And we had some concerns over looting and things getting break-ins and stuff. So we have moved those to a secret location that we will now be bringing back and putting back out. But you can imagine in this dispensing area, every time you touch a pair of glasses, that's a big issue. So our browsing days are probably over. We're probably going to have people sit down after their exam if they are interested in glasses, and have the optician maybe pick 5 pairs for them, and based on their style and something they'd be after and a little bit of a point. Once you've tried on those 5 pairs, and whether people can make a decision that quickly or not, it is a big decision, and we understand that, but we're also trying to limit how long you're in here and how much you're touching. We found out we thought one cool tip was to actually have a slow cooker sitting in the dispensary that has soap and water in it, and we'll be cleaning off those glasses immediately so they can go back up on the board for somebody else to look at. And that's the other thing. We may be asking you when we're rescheduling to know whether you're interested in glasses. We don't usually ask that right off the hop, but we really need to control how many people we can get in that dispensary. And right now it looks like we can only get 1 in there with a salesperson. So again, we really ask for your patience. It's going to look totally different. Even me with a mask on, me apparently talking less, all these different things that you can expect. We're doing this for your health and safety and for our own, so that we can really keep the curve flat. So thank you again, and thank you for your loyalty. Thank you for sticking by us. We're looking forward to seeing you. We'll have smiles under our masks, and we'll see you real soon. Thanks.